Does socialized healthcare affect healthcare quality? Have you ever wondered how socialized healthcare impacts the quality of medical services? Let's break it down together. Socialized healthcare is a system where the government owns and operates healthcare services. It finances care through taxation, aiming to provide universal access to healthcare for everyone. This means that all citizens can receive essential health services without worrying about the costs. One of the main benefits of socialized healthcare is that it reduces financial barriers. When people have access to healthcare without the fear of high costs, they are more likely to seek medical help early. This early intervention can lead to better health outcomes. For instance, catching a health issue early can prevent complications that might requiring expensive emergency care later on. Another key aspect is the focus on primary health care. Primary health care is usually the first point of contact for individuals within the health system. It emphasizes comprehensive and continuous care, which helps improve the quality of services. When patients feel supported and have a trusted relationship with their healthcare providers, they tend to manage chronic diseases more effectively. In countries with socialized healthcare, there is often a single public payer or government agency managing the financing. This setup can lead to higher administrative efficiency. With less overhead and no profit-driven motives, more resources can be directed toward patient care. This can enhance the overall quality of healthcare services. Evidence from various countries shows that socialized healthcare systems often achieve better health outcomes. For example, these countries tend to have lower rates of preventable deaths and higher patient satisfaction. They also manage chronic conditions more effectively. When comparing these nations to the United States, which has a different healthcare model, socialized healthcare often results in longer life expectancy and more equitable access to care, all while spending less per person. However, socialized healthcare systems do face challenges. Some patients may experience longer wait times for elective procedures. Resource allocation can also be a concern. But from a socialist viewpoint, these challenges can be addressed through democratic control and ongoing investment in healthcare infrastructure. The goal is to ensure that quality improves over time and that healthcare meets the needs of the population. In practical terms, socialized healthcare aligns with the broader principle of social ownership of the means of production. In this case, healthcare services are treated as a public good rather than a commodity. This approach promotes health equity by removing financial barriers and prioritizing patient well-being. Overall, socialized healthcare positively affects healthcare quality by providing universal access, emphasizing primary care, improving administrative efficiency, and focusing on equitable health outcomes. These elements are all consistent with the principles of social ownership and social welfare.